Question 1. Implementation of an exercise program for a client who exhibits a strong preference for endurance-based activities and demonstrates excellent sustained effort during prolonged submaximal exercise requires the clinical exercise specialist to consider the underlying physiological characteristics of muscle. Which of the following best guides the CES's approach to program design in this context? Option A. Infer a predominance of type I muscle fibers and design a program that focuses on moderate intensity, longer duration aerobic exercises, while incorporating some resistance training to maintain type II fiber function. Option B. Apply a standardized, general fitness program that includes a mix of cardio and strength training, without specific consideration for the client's observed endurance capabilities. Option C. Recommend the client undergo muscle biopsy to definitively determine their exact muscle fiber composition before any exercise prescription can be finalized. Option D. Design a program that primarily emphasizes high-intensity interval training to maximize recruitment of all muscle fiber types, assuming this will lead to the greatest overall improvement. Correct answer is D. Design a program that primarily emphasizes high-intensity interval training to maximize recruitment of all muscle fiber types, assuming this will lead to the greatest overall improvement. Explanation. Scenario analysis. This scenario presents a professional challenge because a clinical exercise specialist, CES, must accurately interpret and apply knowledge of muscle fiber types to tailor an exercise program for a client with a specific, albeit common, physiological characteristic. Misinterpreting or oversimplifying the role of muscle fiber types can lead to suboptimal programming, potentially impacting client outcomes and adherence. The challenge lies in moving beyond a generalized understanding to a nuanced application that considers individual variability and the practical implications for exercise prescription within the scope of practice for a CES. Correct approach analysis. The correct approach demonstrates best professional practice by recognizing that while general characteristics of type I and type II muscle fibers exist, individual clients will exhibit a continuum of fiber compositions. CES must assess the client's functional goals and current performance to infer their likely fiber type distribution, and then design an exercise program that strategically targets the predominant fiber types while also engaging others. This aligns with the ethical responsibility to provide individualized care and the regulatory expectation for CES professionals to apply evidence-based principles to exercise prescription. The focus is on functional application and client-specific needs, rather than a rigid, theoretical classification. Incorrect approach is analysis. An incorrect approach would be to rigidly classify the client based on a single, perceived characteristic, e.g., they are slow-twitch dominant, and then prescribe exercises solely for that fiber type. This fails to acknowledge the continuum of fiber types and the fact that most individuals have a mix. It also ignores the potential for training adaptations to influence fiber characteristics. This approach is ethically problematic as it leads to a less effective and potentially less safe program. It also represents a failure to adhere to the principle of individualized exercise prescription, which is a cornerstone of professional practice for CES. Another incorrect approach would be to ignore muscle fiber types altogether and apply a generic, one-size-fits-all exercise program. This disregards the scientific understanding of muscle physiology and its direct relevance to exercise performance and adaptation. Ethically, this is a failure to provide competent care and to utilize available knowledge to optimize client outcomes. It also falls short of the professional standard expected of a CES who is trained in exercise physiology. A third incorrect approach would be to attempt to definitively determine the client's exact muscle fiber percentage through invasive methods, which is outside the scope of practice for a CES. While understanding fiber types is crucial, the CES's role is to infer and apply this knowledge through functional assessment and program design, not to perform diagnostic testing. This oversteps professional boundaries and could lead to unnecessary client anxiety or expense. Professional reasoning. When faced with a client whose exercise needs might be influenced by muscle fiber characteristics, a CES should first conduct a thorough functional assessment. This includes evaluating the client's performance in activities requiring different types of muscle contractions, e.g., endurance activities versus power-based movements. Based on this assessment, the CES can make an informed inference about the client's predominant fiber type distribution. The exercise program should then be designed to strategically emphasize training modalities that best stimulate the inferred dominant fiber types, while also incorporating elements that engage other fiber types to promote overall fitness and functional capacity. The program should be adaptable, with ongoing monitoring of the client's progress and responses to training, allowing for adjustments as needed. This iterative process ensures that the program remains individualized, effective, and aligned with the client's goals and the CES's scope of practice. Question 2. Risk assessment procedures indicate that a client performing a high-intensity interval training (HIIT) session reports a strong burning sensation in their quadriceps and a noticeable shaking of the muscles during the final repetitions of a set. Considering the typical functions of skeletal muscle types and their metabolic pathways during such exercise, which of the following best describes the most likely physiological explanation for these sensations and the appropriate professional response? Option A. The burning sensation is a sign of overtraining, and the shaking is a symptom of electrolyte imbalance, requiring a significant reduction in training volume and supplementation with electrolytes. Option B. The burning sensation signifies immediate muscle damage, and the shaking indicates a potential neurological issue, necessitating an immediate cessation of the exercise and referral to a medical professional. Option C. The burning sensation is indicative of anaerobic glycolysis and lactic acid accumulation, and the shaking is a sign of neuromuscular fatigue, both of which are expected responses to high-intensity anaerobic work, suggesting the current intensity is appropriate for developing these physiological systems. Option D. The burning sensation is a sign of insufficient oxygen supply to the muscles, and the shaking is due to dehydration, both of which require immediate reduction in exercise intensity and increased fluid intake. The correct answer is C. The burning sensation is indicative of anaerobic glycolysis and lactic acid accumulation, and the shaking is a sign of neuromuscular fatigue, both of which are expected responses to high-intensity anaerobic work, suggesting the current intensity is appropriate for developing these physiological systems. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the clinical exercise specialist, CES, to interpret subjective client feedback regarding muscle fatigue and translate it into an objective understanding of underlying physiological mechanisms. The client's description of burning and shaking could stem from various factors, including anaerobic metabolism, neuromuscular fatigue, or even anxiety. A CES must differentiate these possibilities to ensure the exercise prescription remains safe, effective, and aligned with the client's goals and physiological capabilities, all while adhering to professional scope of practice and ethical guidelines. Correct approach analysis. The correct approach involves recognizing that the client's description of a burning sensation during high-intensity, short-duration exercise is a hallmark of anaerobic glycolysis and the accumulation of metabolic byproducts like lactic acid. This physiological response is expected and often desired for developing anaerobic power and muscular endurance. The shaking can be attributed to neuromuscular fatigue, where motor units are recruited maximally and struggle to sustain firing rates, leading to involuntary muscle tremors. Understanding these muscle functions and their metabolic underpinnings allows the CES to confidently continue with the prescribed intensity, provided other risk factors are managed, as this is a normal physiological adaptation to the exercise stimulus. This aligns with best professional practice by applying knowledge of exercise physiology to interpret client feedback accurately and make informed decisions about exercise progression. Incorrect approaches analysis. One incorrect approach would be to immediately reduce the exercise intensity or terminate the set solely based on the client's subjective report of burning and shaking without considering the physiological context. This fails to acknowledge the normal metabolic and neuromuscular responses to high-intensity exercise. Ethically, this could be considered a failure to adequately challenge the client within safe parameters, potentially hindering progress and not meeting professional obligations to optimize training. From a regulatory perspective, it might indicate a lack of competence in exercise physiology interpretation. Another incorrect approach would be to attribute the burning and shaking solely to an immediate need for rest or a sign of overexertion without further assessment. This overlooks the specific characteristics of the exercise, high intensity, short duration, which are designed to elicit these responses. It could lead to an unnecessarily conservative exercise prescription, limiting the client's potential gains in anaerobic capacity and muscular strength. This would be a failure to apply best practices in exercise prescription and could be seen as a deviation from the CES's role in optimizing performance. A further incorrect approach would be to dismiss the client's feedback as insignificant or simply a sign of pushing hard, without attempting to understand the underlying physiological mechanisms. While the client is indeed pushing hard, the CES has a professional responsibility to interpret these signals. Ignoring the feedback, even if it's a normal response, could lead to a missed opportunity to educate the client about their body's responses and build trust. It also fails to consider that in some individuals, these sensations could be exacerbated by other factors, and a CES should be attuned to subtle signs of distress beyond typical fatigue. Professional reasoning. When faced with subjective client feedback during exercise, a CES should employ a systematic decision-making process. First, consider the context. What type of exercise is being performed? Intensity, duration, mode. Second, relate the client's subjective sensations to known physiological responses of the involved muscle types and energy systems. Third, assess for any objective signs of distress or contraindications, e.g., excessive pallor, dizziness, pain unrelated to muscle fatigue. Fourth, communicate with the client to gather more specific details about their sensations. Finally, make an informed decision based on the synthesis of this information, prioritizing client safety while optimizing the exercise stimulus for desired adaptations. This process ensures that interventions are evidence-based and aligned with professional standards of care. Question 3. Quality control measures reveal that during a supervised exercise session, a client's systolic blood pressure has risen significantly above their baseline resting measurement and is approaching a level that warrants concern according to established clinical guidelines for exercise. The client reports no subjective symptoms of dizziness or chest discomfort. What is the most appropriate immediate course of action for the clinical exercise specialist? Option A. Immediately terminate the exercise session and advise the client to seek immediate medical evaluation from their physician. Option B. Advise the client to reduce the intensity of their next exercise session and monitor their blood pressure more closely in future sessions. Option C. Continue the exercise session at the current intensity as the client is not reporting any symptoms. Option D. Pause the current exercise bout, reassess the client's blood pressure, and if it remains elevated, consult with the client's physician before proceeding with further exercise. The correct answer is A. Immediately terminate the exercise session and advise the client to seek immediate medical evaluation from their physician. Explanation. This scenario presents a professional challenge because it requires a clinical exercise specialist, CES, to navigate a situation where a client's physiological response to exercise, specifically blood pressure regulation, is deviating from expected norms. The CES must exercise careful judgment to determine the appropriate course of action, balancing the client's exercise goals with their safety and well-being, all within the scope of practice and regulatory guidelines. The core of the challenge lies in interpreting the client's response, understanding the potential implications for their health, and deciding whether to modify the exercise program, seek further medical advice, or continue as planned. The correct approach represents best professional practice because it prioritizes client safety and adheres to established professional standards for monitoring and responding to exercise-induced physiological changes. Specifically, it involves recognizing a potential deviation from normal blood pressure response during exercise, which could indicate an underlying issue or a risk to the client's cardiovascular health. By pausing the exercise session and consulting with the client's physician, the CES is acting within their scope of practice, which typically includes monitoring vital signs and recognizing when to refer to a medical professional. This aligns with ethical obligations to avoid harm and to practice within one's competence. Regulatory frameworks for CES often mandate such vigilance and referral protocols to ensure client safety and prevent adverse events. An incorrect approach that involves continuing the exercise session without modification or further assessment will be professionally unacceptable. This failure to recognize and respond to a potentially concerning blood pressure reading constitutes a breach of the duty of care owed to the client. It could lead to serious adverse cardiovascular events, such as hypertensive crisis or stroke, directly attributable to the CES's inaction. Ethically, this violates the principle of non-maleficence, do no harm. From a regulatory perspective, it could be seen as practicing outside the bounds of safe and competent care, potentially leading to disciplinary action by professional bodies or licensing boards. Another incorrect approach, such as immediately terminating all exercise for the client without further investigation or consultation, might also be professionally problematic. Prioritizing safety, this approach may be overly cautious and could unnecessarily restrict the client's access to beneficial exercise. It fails to consider the nuances of blood pressure responses and the possibility that the observed reading might be transient or influenced by factors other than a serious underlying condition. This could also be seen as a failure to adequately assess the situation and provide individualized care, potentially impacting the client's adherence to an exercise program that could otherwise be beneficial. A third incorrect approach, such as dismissing the elevated reading as insignificant without any documentation or follow-up, is also unacceptable. This demonstrates a lack of professional diligence and an abdication of responsibility. Failing to document such findings and to consider their implications over time prevents a comprehensive understanding of the client's physiological responses and hinders effective communication with healthcare providers. This can lead to a fragmented approach to client care and potentially missed opportunities for early intervention. The professional reasoning process for similar situations should involve a systematic approach. 1. Vigilant monitoring of vital signs during exercise. 2. Recognition of deviations from expected or normal physiological responses. 3. Understanding the potential implications of these deviations based on current knowledge and professional guidelines. 4. Decision-making based on risk assessment, considering the client's individual health status, exercise intensity, and the observed response. 5. Implementing appropriate interventions, which may include modifying the exercise, pausing the session, or referring to a physician. 6. Clear and timely communication with the client and their healthcare provider. 7. Thorough documentation of all observations, interventions, and communications. This structured approach ensures that client safety is paramount, while also facilitating effective and evidence-based exercise programming. Question 4. The audit findings indicate a potential deficiency in the clinical exercise specialist's understanding of how a client's prescribed beta-blocker medication might influence the interaction between their endocrine and nervous systems during exercise, specifically concerning heart rate variability and perceived exertion. Which of the following actions best addresses this finding in accordance with U.S. regulatory frameworks for allied health professionals? Option A. Focus solely on the client's subjective feedback during exercise sessions, assuming that any physiological changes due to the medication will be readily apparent and manageable through standard exercise modifications. Option B. Review the client's medical chart for physician notes regarding exercise recommendations and consult with the prescribing physician to discuss the potential impact of the beta blocker on the client's exercise response and to collaboratively adjust the exercise prescription. Option C. Immediately cease all exercise for the client until a comprehensive review of all potential drug-exercise interactions can be completed, prioritizing absolute client safety above all else. Option D. Advise the client to independently research the effects of beta blockers on exercise and to report any subjective changes in their physical sensations during activity. The correct answer is B. Review the client's medical chart for physician notes regarding exercise recommendations and consult with the prescribing physician to discuss the potential impact of the beta blocker on the client's exercise response and to collaboratively adjust the exercise prescription. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires a clinical exercise specialist, CES, to interpret complex physiological interactions within the context of a client's specific health condition and medication regimen. The interplay between the endocrine and nervous systems is intricate, and understanding how exercise influences these systems, especially when modulated by pharmacological agents, demands a high level of applied knowledge. The audit findings highlight a potential gap in the CES's ability to accurately assess and respond to these physiological nuances, which could impact client safety and the efficacy of the prescribed exercise program. Careful judgment is required to ensure that the CES's actions are evidence-based, client-centered, and compliant with professional standards. Correct approach analysis. The correct approach involves a thorough review of the client's medical history, current medication list, and the specific physiological effects of both the prescribed exercise and the client's medication on the endocrine and nervous systems. This includes understanding how beta blockers, for instance, can blunt the sympathetic nervous system's response to exercise, affecting heart rate and perceived exertion. The CES must then integrate this understanding to modify the exercise prescription, prioritizing safety by monitoring for signs and symptoms of autonomic dysfunction or inadequate physiological adaptation. This approach aligns with the CES's professional responsibility to provide safe and effective exercise programming, adhering to the ethical principle of beneficence and non-maleficence, and implicitly, the regulatory expectation of competent practice as outlined by professional bodies governing CES practice in the U.S. It demonstrates a commitment to evidence-based practice and individualized care. Incorrect approaches analysis. One incorrect approach would be to dismiss the audit findings without further investigation, assuming the existing exercise program is adequate. This fails to acknowledge the potential for exercise to interact with the client's endocrine and nervous system responses, especially when influenced by medication. Such an approach could lead to an unsafe exercise prescription, potentially causing adverse cardiovascular events or other physiological imbalances, violating the CES's duty of care. Another incorrect approach would be to make significant, unverified changes to the exercise program based solely on anecdotal information or general knowledge, without consulting the client's physician or reviewing specific research related to the client's condition and medication. This bypasses essential collaborative care protocols and could lead to inappropriate exercise modifications that are either too aggressive or too conservative, failing to optimize client outcomes and potentially contravening guidelines for interprofessional collaboration in healthcare. A third incorrect approach would be to focus solely on the nervous system's role in exercise response and neglect the significant influence of the endocrine system, particularly if the client has conditions like diabetes or thyroid disorders. This compartmentalized thinking overlooks the integrated nature of these systems and the potential for exercise to impact hormonal regulation, e.g., insulin sensitivity, cortisol levels, which is critical for overall health and exercise tolerance. This failure to consider the holistic physiological response would be a significant professional and ethical lapse. Professional reasoning. When faced with audit findings that suggest a potential deficit in understanding complex physiological interactions, a CES should initiate a systematic process. This involves 1. Acknowledging the findings and their potential implications for client care. 2. Conducting a comprehensive review of the client's specific case, including medical history, medications, and current physiological status. 3. Consulting relevant scientific literature and professional guidelines pertaining to the interaction of exercise, the endocrine system, and the nervous system in the context of the client's condition and treatment. 4. Collaborating with the client's physician or other healthcare providers to ensure a coordinated and safe approach to exercise prescription and modification. 5. Documenting all assessments, decisions, and communications thoroughly. This structured approach ensures that client safety is paramount and that the CES is practicing within the scope of their competence and adhering to professional and regulatory expectations. Question 5. Investigation of the cardiac response to exercise in a client who has recently experienced a myocardial infarction, MI, requires a deep understanding of myocardial mechanics. Considering the typical physiological sequelae of an MI, which of the following anatomical and physiological considerations is most critical when designing an exercise program to promote recovery and minimize further cardiac stress? Option A. The impact of exercise on the autonomic nervous system's regulation of heart rate and contractility, and how this influences myocardial oxygen demand relative to supply. Option B. The metabolic pathways involved in skeletal muscle energy production and their efficiency in sustained aerobic activity. Option C. The role of the pericardium in limiting ventricular expansion and its potential to restrict stroke volume during increased venous return. Option D. The structural integrity of the valves, particularly the mitral and aortic valves, and their ability to prevent retrograde blood flow during ventricular contraction. Correct answer is A. The impact of exercise on the autonomic nervous system's regulation of heart rate and contractility, and how this influences myocardial oxygen demand relative to supply. Explanation. Scenario analysis. This scenario presents a professional challenge due to the need to interpret complex anatomical and physiological information in the context of a client's specific condition and potential contraindications. Clinical exercise specialist, CES, must move beyond rote memorization of anatomical structures and understand how their function can be impacted by disease processes, thereby influencing exercise prescription. The challenge lies in accurately assessing the client's current physiological state and predicting how different exercise modalities might affect their cardiovascular system, specifically the compromised myocardial tissue. This requires a nuanced understanding of cardiac anatomy and physiology, coupled with an awareness of the potential risks and benefits of exercise in a compromised state. Correct approach analysis. The correct approach involves a thorough understanding of the cardiac cycle, specifically the phases of systole and diastole, and how myocardial infarction (MI) affects these processes. Following an MI, the damaged myocardium has reduced contractility and impaired relaxation. Therefore, exercise that significantly increases myocardial oxygen demand, leading to increased heart rate and contractility, enhanced sympathetic drive, can exacerbate ischemia and potentially lead to further damage or arrhythmias. A CES must prioritize interventions that minimize myocardial workload during systole and allow for adequate diastolic filling. This means considering exercises that promote a gradual heart rate increase, avoid sudden surges in blood pressure, and allow sufficient time for the ventricles to fill. Understanding the interplay between preload, afterload, and contractility is crucial for selecting safe and effective exercise strategies. This aligns with best professional practice by prioritizing client safety and evidence-based exercise programming, adhering to the ethical obligation to do no harm, and the professional standards of practice that require a comprehensive understanding of the physiological implications of exercise on cardiovascular health. Incorrect approaches analysis. One incorrect approach would be to focus solely on increasing aerobic capacity without considering the specific impact of MI on cardiac function. This might involve prescribing high-intensity interval training (HIIT) without adequate assessment of the client's ability to tolerate the rapid increases in heart rate and blood pressure during the work intervals, potentially leading to excessive myocardial strain and increased risk of adverse cardiac events. This fails to adhere to the principle of individualized exercise prescription and disregards the specific physiological limitations imposed by the MI. Another incorrect approach would be to recommend exercises that significantly increase afterload without considering the compromised contractility of the heart. For example, prescribing heavy resistance training with Valsalva maneuvers could lead to a dangerous spike in blood pressure, increasing the workload on the already weakened heart and potentially causing further myocardial damage or arrhythmias. This demonstrates a lack of understanding of the hemodynamic consequences of exercise in individuals with cardiac compromise and violates the ethical duty to provide safe and appropriate care. A third incorrect approach might be to overlook the importance of diastolic function. While systolic function is often the primary focus after an MI, impaired diastolic relaxation can also limit exercise capacity and increase the risk of heart failure. Recommending exercises that do not allow for adequate diastolic filling time, such as very rapid repetitions in resistance training or extremely high-cadence aerobic activities, could be detrimental. This shows an incomplete understanding of cardiac physiology and its implications for exercise prescription. Professional reasoning. Professionals should approach such scenarios by first conducting a comprehensive client assessment, including a review of medical history, diagnostic reports, e.g., echocardiogram, stress tests, and any physician recommendations. This is followed by a functional assessment to gauge the client's current exercise tolerance and identify any specific limitations. The CES should then apply their knowledge of anatomy and physiology, specifically focusing on how the client's condition impacts cardiovascular mechanics. Decision-making should be guided by evidence-based practice, prioritizing safety and efficacy. This involves selecting exercise modalities that are appropriate for the client's physiological state, gradually progressing intensity and duration as tolerated, and continuously monitoring the client for any signs of distress or adverse reactions. Collaboration with the client's physician or other healthcare providers is essential for ensuring a coordinated and safe approach to exercise rehabilitation. Question 6. What factors determine the most appropriate clinical exercise intervention for a client experiencing joint pain during specific movements, considering both their subjective report and objective biomechanical assessment? Option A, the general classification of the movement, e.g., flexion, extension, without a detailed analysis of the joint's arthrokinematics and muscle force vectors. Option B, a standardized exercise protocol for the client's diagnosed condition, irrespective of individual biomechanical findings. Option C, the client's self-reported perception of normal movement patterns without objective biomechanical evaluation. Option D, the client's subjective description of pain, the CES's objective assessment of joint range of motion, muscle activation, and compensatory strategies, and the underlying biomechanical principles of the affected joint. The correct answer is D. The client's subjective description of pain, the CES's objective assessment of joint range of motion, muscle activation, and compensatory strategies, and the underlying biomechanical principles of the affected joint. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a clinical exercise specialist, CES, to balance the client's subjective experience of pain with objective biomechanical principles of joint movement. The client's perception of normal movement, influenced by their lived experience and potentially misinformation, can conflict with the CES's understanding of optimal joint mechanics. The CES must navigate this discrepancy while ensuring client safety and adherence to evidence-based practice, all within the scope of their professional responsibilities as defined by the CES regulatory framework. Failure to do so could lead to ineffective interventions, exacerbation of symptoms, or even injury, and could also breach professional conduct standards. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based assessment of joint mechanics that directly informs the exercise prescription. By considering the client's reported pain, the CES's objective assessment of joint range of motion, muscle activation patterns, and compensatory movements, and the underlying biomechanical principles of the specific joint, the CES can develop a safe and effective exercise program. This aligns with the CES's ethical obligation to provide competent care based on scientific principles and to individualize interventions. The regulatory framework for CES emphasizes the application of exercise science to improve health and function, which necessitates a thorough understanding of how joint mechanics influence movement and potential pain. Incorrect approaches analysis. One incorrect approach would be to solely rely on the client's subjective report of normal movement without objective biomechanical assessment. This fails to acknowledge that a client's perception of normal can be altered by chronic pain, learned movement patterns, or lack of awareness of biomechanical deviations. Ethically, this approach neglects the CES's duty to perform a thorough assessment and could lead to prescribing exercises that reinforce dysfunctional movement patterns, potentially causing harm and violating the principle of non-maleficence. It also disregards the regulatory expectation for evidence-based practice. Another incorrect approach would be to apply a standardized, generic exercise protocol for a specific joint condition without considering the individual's unique joint mechanics and pain presentation. This ignores the principle of individualized care, a cornerstone of professional practice. Regulatory guidelines for CES typically mandate tailoring interventions to the client's specific needs and capabilities. Such a generic approach risks prescribing exercises that are inappropriate for the client's current functional status, potentially leading to pain exacerbation or injury, and failing to address the root biomechanical causes of their limitations. A third incorrect approach would be to focus exclusively on the type of movement e.g., flexion, extension without analyzing the underlying joint mechanics, e.g., joint play, arthrokinematics, muscle force vectors. While understanding movement types is important, it is insufficient without a deeper biomechanical analysis. This superficial approach might lead to interventions that do not address the true source of movement dysfunction. It represents a failure to apply the full scope of knowledge expected of a CES, potentially leading to ineffective treatment and a breach of professional competence standards. Professional reasoning. Professionals should adopt a systematic decision-making process that begins with a thorough client history, including their subjective experience of pain and movement. This is followed by a comprehensive objective assessment that evaluates joint range of motion, muscle strength and flexibility, postural alignment, and movement patterns. The CES must then integrate this objective data with their knowledge of biomechanics, kinesiology, and exercise physiology to identify any deviations from optimal joint mechanics. This integrated understanding then guides the selection of appropriate exercise interventions, prioritizing safety, efficacy, and individual client goals, all while adhering to the CES regulatory framework and ethical codes. Question 7. When evaluating a client with a history of asthma performing a moderate-intensity aerobic exercise session, and you observe an increased respiratory rate, noticeable accessory muscle use, and the client reports feeling a bit winded, but can still complete the set repetitions, what is the most appropriate course of action for a clinical exercise specialist? Option A. Continue with the prescribed intensity and repetition, assuming the client's subjective report indicates they are managing the exertion. Option B. Immediately reduce the exercise intensity and duration, and assess for any audible wheezing or significant drop in oxygen saturation. Option C. Advise the client to simply take deeper breaths and continue the exercise at the current intensity to build respiratory muscle strength. Option D. Focus solely on the client's heart rate response to ensure it remains within the target zone, as this is the primary indicator of cardiovascular adaptation. The correct answer is B. Immediately reduce the exercise intensity and duration, and assess for any audible wheezing or significant drop in oxygen saturation. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a clinical exercise specialist, CES, to interpret subtle physiological responses during exercise, specifically related to breathing mechanics, in a client with a known respiratory condition. The challenge lies in distinguishing between normal exercise-induced physiological adaptations and potential signs of respiratory distress or inefficient breathing patterns that could compromise the client's safety and exercise outcomes. A CES must possess a strong understanding of respiratory physiology and be able to apply this knowledge in a practical, real-time assessment setting, adhering strictly to the scope of practice and ethical guidelines. Correct approach analysis. The correct approach involves a comprehensive assessment of the client's breathing pattern, including rate, depth, and perceived exertion related to breathing, in conjunction with objective measures like oxygen saturation and heart rate. This approach aligns with the CES's role in designing and implementing safe and effective exercise programs. By observing and quantifying these parameters, the CES can identify deviations from expected responses, which may indicate the need for modifications to the exercise intensity, duration, or type, or necessitate referral to a physician or respiratory therapist. This aligns with the ethical imperative to prioritize client safety and well-being, as well as the professional responsibility to practice within the established scope of practice for a CES, which includes assessing exercise responses and making appropriate program adjustments. Incorrect approach is analysis. One incorrect approach is to solely rely on the client's subjective report of feeling fine without objective assessment. This fails to acknowledge that individuals with respiratory conditions may have a blunted perception of dyspnea or may not recognize early signs of respiratory compromise. Ethically, this approach neglects the CES's duty of care and could lead to overexertion and adverse events. It also falls outside best professional practice by not utilizing available assessment tools to ensure safety. Another incorrect approach is to immediately increase exercise intensity based on the client's ability to complete the prescribed repetitions, disregarding any observable signs of labored breathing or a disproportionately high respiratory rate. This demonstrates a lack of understanding of the mechanics of breathing and its impact on exercise capacity, particularly in individuals with compromised respiratory function. This approach violates the principle of individualized exercise prescription and could lead to respiratory fatigue, exacerbation of symptoms, and potential harm, representing a failure to adhere to safety protocols and professional judgment. A third incorrect approach is to focus exclusively on cardiovascular responses, e.g., heart rate, and ignore the respiratory component of the exercise response. While cardiovascular health is crucial, respiratory limitations can significantly impact exercise tolerance and performance. Ignoring breathing mechanics means missing critical information about the client's physiological state and potentially prescribing an exercise program that is not optimally tailored to their needs or safe for their condition. This represents a failure to conduct a holistic assessment and can lead to suboptimal or unsafe exercise programming. Professional reasoning. When faced with a client exhibiting signs that might indicate altered breathing mechanics during exercise, a CES should employ a systematic decision-making framework. This framework begins with a thorough understanding of the client's medical history and current respiratory status. Next, the CES must perform a comprehensive assessment, integrating subjective feedback with objective physiological measures. This includes observing the breathing pattern, measuring respiratory rate and depth, monitoring oxygen saturation, and assessing perceived exertion related to breathing. Based on this integrated data, the CES should compare the client's response to expected norms for their condition and exercise intensity. If any concerning deviations are noted, the CES must then consider appropriate interventions, which may include modifying the exercise prescription, e.g., reducing intensity, incorporating rest periods, altering breathing techniques, educating the client on proper breathing strategies, or referring the client to their physician or other healthcare professionals for further evaluation. This iterative process ensures client safety, optimizes exercise outcomes, and upholds professional standards of care. Question 8. The risk matrix shows a moderate likelihood of a client with a diagnosed neuromuscular disorder experiencing increased fatigue and weakness during their supervised exercise session. The client reports feeling unusually tired and my legs feel like jelly. What is the most appropriate initial approach for the clinical exercise specialist? Option A. Immediately stop the exercise session. Conduct a thorough subjective and objective assessment of the client's current status and review their recent exercise history and current medication list for potential contributing factors. Option B. Ignore the client's subjective report and proceed with the planned exercise session as scheduled, focusing on completing the prescribed repetitions. Option C. Continue the exercise session at a reduced intensity, assuming the symptoms are a normal physiological response to exertion. Option D. Advise the client to push through the fatigue, as this is a common experience for individuals with neuromuscular conditions and can lead to improved strength. The correct answer is A. Immediately stop the exercise session. Conduct a thorough subjective and objective assessment of the client's current status, and review their recent exercise history and current medication list for potential contributing factors. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a clinical exercise specialist, CES, to interpret a client's subjective report of fatigue and weakness in the context of their underlying neuromuscular condition. The CES must differentiate between normal physiological responses to exercise and potential signs of overexertion or a worsening of the condition, which could have serious health implications. This requires a nuanced understanding of neuromuscular physiology and the ability to apply that knowledge to individual client presentations, while adhering to professional scope of practice and client safety protocols. Correct approach analysis. The correct approach involves a systematic assessment that begins with gathering detailed subjective information from the client, followed by objective physiological measurements and a review of their medical history and current exercise program. This aligns with best professional practice for CESs, emphasizing a client-centered, evidence-based approach. Specifically, it involves 1. Detailed subjective inquiry, asking targeted questions about the onset, duration, intensity, and specific nature of the fatigue and weakness. This helps to understand the client's experience and identify potential triggers or patterns. 2. Objective assessment, measuring relevant physiological parameters such as heart rate, blood pressure, oxygen saturation, and potentially muscle strength or endurance tests, if within scope and appropriate for the client's condition. This provides objective data to complement the subjective report. 3. Program review, evaluating the current exercise prescription to determine if the intensity, duration, or type of exercise might be contributing to the symptoms. 4. Consultation with healthcare provider, if the symptoms are severe, persistent, or suggest a significant change in the client's condition. Consulting with their physician or referring them for further medical evaluation is paramount. This ensures the client receives appropriate medical management and that the CES's exercise interventions remain safe and effective. This comprehensive approach is ethically mandated by the CES's responsibility to prioritize client safety and well-being, and it is supported by professional guidelines that advocate for thorough assessment and ongoing monitoring of clients with chronic conditions. Incorrect approach is analysis. Ignoring the client's subjective report of fatigue and weakness is a significant regulatory and ethical failure. It demonstrates a disregard for the client's lived experience and can lead to serious adverse events, including overexertion, injury, or exacerbation of their neuromuscular condition. This violates the CES's duty of care and professional responsibility to monitor and respond to client symptoms. Assuming the symptoms are simply a normal response to exercise without further investigation is also professionally unacceptable. While some fatigue is expected, significant or unusual weakness warrants a thorough assessment. This approach can lead to misdiagnosis of the cause of the symptoms and potentially harmful exercise prescriptions. It fails to uphold the CES's obligation to exercise sound professional judgment and to adapt interventions based on individual client responses. Immediately ceasing all exercise without a proper assessment is also an incorrect approach. Caution is necessary. An abrupt cessation might be unnecessary and could negatively impact the client's physical and psychological well-being. A proper assessment is needed to determine the cause and appropriate course of action, which may include modifying the exercise program rather than stopping it entirely. This approach lacks the analytical rigor required for effective client management. Professional reasoning. When faced with a client reporting new or worsening symptoms, CES should employ a structured decision-making process. 1. Prioritize safety. Always err on the side of caution when client well-being is at stake. 2. Gather comprehensive data. Collect both subjective and objective information. 3. Analyze the data. Interpret the findings in the context of the client's condition, exercise history, and known physiological responses. 4. Consult and collaborate. Seek input from other healthcare professionals when necessary. 5. Adapt interventions. Modify exercise programs based on assessment findings and client response. 6. Document thoroughly. Maintain detailed records of assessments, interventions, and client progress. Question 9. The evaluation methodology shows a client reporting significant fatigue during a submaximal aerobic exercise bout, yet their heart rate and perceived exertion (RPE) scores are within the expected ranges for the prescribed intensity. Considering the predominant energy systems involved in sustained submaximal aerobic activity, which of the following interpretations best guides the clinical exercise specialist's next steps in program adjustment? Option A. The client's reported fatigue is likely a psychological response to the exercise and can be overcome by increasing the exercise intensity to challenge their mental fortitude, assuming their cardiovascular system can handle the load. Option B. The client's fatigue is a sign of poor anaerobic conditioning, and the focus should shift entirely to high-intensity interval training to improve their ability to tolerate lactic acid accumulation. Option C. The client's subjective fatigue may indicate a need to explore factors beyond immediate aerobic capacity, such as the efficiency of the phosphagon or glycolytic systems in buffering metabolic byproducts, or central fatigue mechanisms, necessitating a review of exercise duration, rest intervals, and overall training load. Option D. The client's fatigue is a direct indicator that the aerobic system is failing to meet the energy demands, and the exercise intensity must be immediately reduced to prevent cardiovascular strain, irrespective of objective measures. The correct answer is C. The client's subjective fatigue may indicate a need to explore factors beyond immediate aerobic capacity, such as the efficiency of the phosphagon or glycolytic systems in buffering metabolic byproducts, or central fatigue mechanisms, necessitating a review of exercise duration, rest intervals, and overall training load. Explanation. The scenario presents a common challenge for a clinical exercise specialist, CES, where a client's subjective experience of fatigue during exercise does not align with objective physiological markers. This discrepancy requires careful interpretation, as relying solely on one type of data can lead to inappropriate exercise prescription and potentially compromise client safety or efficacy. The CES must integrate knowledge of energy system contributions to exercise intensity and duration with the client's individual response. The correct approach involves a comprehensive assessment that considers the client's reported exertion alongside objective measures and an understanding of how different energy systems predominantly utilized at varying exercise intensities. This aligns with best professional practice by prioritizing a holistic and individualized approach to exercise prescription. Regulatory frameworks for CES typically emphasize client-centered care, evidence-based practice, and the importance of ongoing assessment and adaptation. By considering the interplay of subjective and objective data, The CES demonstrates adherence to these principles, ensuring the exercise program is safe, effective, and tailored to the client's unique physiological and perceptual responses. An incorrect approach would be to dismiss the client's subjective fatigue solely, because objective measures like heart rate or oxygen saturation appear within acceptable ranges. This fails to acknowledge the complex nature of fatigue, which can be influenced by factors beyond immediate physiological responses, such as central fatigue, psychological state, or metabolic byproducts not fully captured by standard metrics. Ethically, ignoring a client's reported experience can erode trust and lead to a suboptimal or even harmful exercise prescription. From a regulatory standpoint, this approach may violate standards of care that mandate thorough client assessment and consideration of all reported symptoms. Another incorrect approach would be to solely focus on increasing exercise intensity to push through the perceived fatigue, assuming it's a sign of insufficient effort. This disregards the potential for overtraining, inadequate recovery, or underlying physiological limitations that the client is signaling. Such an approach could lead to adverse events, burnout, and a negative perception of exercise, potentially contravening guidelines related to client safety and promoting sustainable exercise habits. The professional reasoning process in such a situation should involve 1. Actively listening to and validating the client's subjective experience. 2. Correlating this experience with objective data, understanding the limitations of each. 3. Considering the predominant energy systems at play during the exercise bout and how they might contribute to fatigue. 4. Adjusting exercise prescription based on the integrated assessment, potentially modifying intensity, duration, rest periods, or exercise modality. 5. Educating the client about the interplay of subjective and objective measures and the rationale behind program adjustments. Question 10. The control framework reveals that a clinical exercise specialist is developing an exercise program for a client with a history of stable angina and hypertension, who is currently taking a beta blocker. Which of the following approaches best aligns with the regulatory and ethical requirements for providing safe and effective cardiovascular exercise programming? Option A. Design an exercise program that incorporates a thorough assessment of the client's current cardiovascular status, including resting and exercise hemodynamics, and adjusts exercise intensity and duration based on the known effects of the beta blocker on heart rate response and perceived exertion. Option B. Implement an exercise program based on general guidelines for individuals with cardiovascular disease, focusing on achieving a target heart rate range derived from a standard age-predicted formula without specific consideration for the beta blocker medication. Option C. Prescribe a high-intensity interval training program to maximize cardiovascular benefits, assuming that the client's stable angina indicates they can tolerate strenuous activity. Option D. Recommend a program of light aerobic activity only, avoiding any form of resistance training, due to the client's history of hypertension, without further assessment of their capacity for strength development. The correct answer is B. Implement an exercise program based on general guidelines for individuals with cardiovascular disease, focusing on achieving a target heart rate range derived from a standard age-predicted formula, without specific consideration for the beta blocker medication. Explanation. This scenario presents a professional challenge due to the inherent variability in individual cardiovascular responses to exercise and the need to balance exercise prescription with client safety and efficacy. A clinical exercise specialist, CES, must navigate the complexities of a client's cardiovascular system, considering their specific condition, medication, and potential for adverse events. Careful judgment is required to tailor an exercise program that is both beneficial and safe, adhering to established professional standards and regulatory guidelines. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment and ongoing monitoring. This aligns with the core principles of evidence-based practice and client-centered care, which are fundamental to the CES role. Specifically, it reflects the regulatory requirement to practice within one's scope of competence and to act in the best interest of the client. This approach ensures that the exercise prescription is informed by the client's unique physiological profile and response, minimizing risks and maximizing therapeutic benefits, thereby upholding the ethical duty of care. An incorrect approach that relies solely on generalized population-based guidelines fails to acknowledge individual differences in cardiovascular function and medication effects. This could lead to an exercise prescription that is either too aggressive, potentially causing adverse cardiovascular events, or too conservative, limiting the client's potential for improvement. Such an approach would violate the ethical principle of beneficence and non-maleficence, as it does not adequately protect the client from harm or promote their well-being. Furthermore, it may contravene regulatory expectations for personalized care and the application of professional judgment. Another incorrect approach that neglects to consider the client's current medication regimen is equally problematic. Many cardiovascular medications significantly alter heart rate, blood pressure, and exercise capacity. Failing to account for these pharmacological effects can result in inaccurate assessments of exercise intensity and an inappropriate prescription, potentially leading to overexertion or underexertion, both of which compromise the effectiveness and safety of the program. This oversight represents a failure to adhere to professional standards of practice and a potential breach of the duty of care. The professional reasoning process for similar situations should involve a systematic approach. First, thoroughly review the client's medical history, including their specific cardiovascular condition, any comorbidities, and all current medications. Second, conduct a comprehensive pre-exercise assessment, which may include functional capacity testing, to establish baseline physiological parameters. Third, develop an individualized exercise prescription that considers the client's goals, limitations, and the impact of their medical status and medications. Fourth, implement a robust monitoring plan during exercise sessions, observing for signs and symptoms of intolerance or adverse events. Finally, maintain ongoing communication with the client and their healthcare providers, making necessary adjustments to the program based on the client's response and evolving clinical status. This iterative process ensures that the exercise program remains safe, effective, and aligned with the client's overall health management. Question 11. System analysis indicates a clinical exercise specialist, CES, is working with a client who has recently completed a medical clearance for exercise. The client expresses a strong desire to significantly improve their cardiovascular endurance and get in shape quickly within the next month, citing a desire to participate in a local charity run. The client suggests a daily, high-intensity interval training (HIIT) program, believing this will yield the fastest results. The CES understands that, while HIIT can be effective, the physiological adaptations underpinning substantial improvements in aerobic metabolism, such as increased mitochondrial density and capillary network development, typically require a more sustained and progressive training stimulus over several weeks to months. The CES also recognizes the potential risks of overtraining and injury if the client's proposed regimen is implemented without careful consideration of their current fitness level and the body's capacity for adaptation. What is the most ethically and professionally appropriate course of action for the CES in this situation? Option A. Recommend a complete cessation of exercise for the next month to allow the body to rest and recover before starting any new program, as the client's desire for rapid progress may indicate an underlying issue. Option B. Educate the client on the physiological principles of aerobic adaptation, explaining the time course of improvements in VO2 max and the importance of progressive overload for sustainable gains, while collaboratively developing a safe and effective program that incorporates elements of HIIT judiciously and aligns with the client's goal of participating in the charity run. Option C. Immediately implement the client's proposed daily HIIT program, assuming the client is motivated and capable of handling the intensity to meet their perceived need for rapid results. Option D. Advise the client that their goal of significant improvement within 1 month is unrealistic and suggest they focus on a much slower, less intense training approach, without fully explaining the physiological basis for this recommendation. Correct answer is B. Educate the client on the physiological principles of aerobic adaptation, explaining the time course of improvements in VO2 max and the importance of progressive overload for sustainable gains, while collaboratively developing a safe and effective program that incorporates elements of HIIT judiciously and aligns with the client's goal of participating in the charity run. Explanation. Scenario analysis. This scenario presents a professional challenge where a clinical exercise specialist, CES, must balance a client's expressed desire for rapid progress with the physiological realities of aerobic metabolism and the ethical imperative to provide safe and evidence-based care. The client's misunderstanding of how aerobic adaptations occur, particularly the time required for mitochondrial biogenesis and capillary density improvements, creates a potential conflict. The CES must navigate this by educating the client and setting realistic expectations without alienating them or compromising their adherence to a safe and effective program. The CES's responsibility extends beyond simply prescribing exercise. It includes client education and fostering a sustainable approach to health improvement. Correct approach analysis. The correct approach prioritizes client safety and long-term adherence by aligning the exercise prescription with the physiological principles of aerobic metabolism. This involves educating the client about the gradual nature of aerobic adaptations, such as the time it takes for the body to increase mitochondrial density and capillary networks, which are crucial for improving oxygen utilization and endurance. By explaining that significant improvements in VO2 max and sustained energy production are a result of consistent, progressive training over weeks and months, rather than a few intense sessions, the CES upholds their ethical duty to provide evidence-based practice. This approach respects the client's goals while ensuring the program is physiologically sound and minimizes the risk of overtraining or injury, thereby promoting sustainable health outcomes. This aligns with the core principles of professional conduct for a CES, emphasizing client well-being and informed consent. Incorrect approach is analysis. One incorrect approach involves immediately acquiescing to the client's demand for an extremely high-intensity, high-frequency program without adequate explanation. This fails to acknowledge the physiological limitations of aerobic adaptation and the risks associated with rapid, unsustainable increases in training load. Such an approach could lead to overtraining syndrome, burnout, injury, and a loss of client trust when the desired rapid results do not materialize or are accompanied by adverse effects. Ethically, this violates the principle of beneficence, acting in the client's best interest, and non-maleficence, avoiding harm. Another incorrect approach is to dismiss the client's goals outright and rigidly adhere to a predetermined, conservative program, without attempting to understand or address the client's motivations. This can lead to client disengagement and a failure to achieve adherence, as the client may feel unheard or that their aspirations are not valued. While safety is paramount, a CES must also strive for client-centered care, which involves collaborative goal setting and program modification where appropriate and safe. This approach neglects the importance of client motivation and the therapeutic relationship. A third incorrect approach might be to overemphasize the client's perceived impatience without providing concrete physiological explanations. While acknowledging the client's desire for quick results is important, simply stating that they need to be patient without explaining the underlying biological processes of aerobic adaptation does not empower the client with knowledge. This can lead to frustration and a lack of understanding, making it harder for the client to commit to the long-term process. Effective client education is key to fostering adherence and realistic expectations. Professional reasoning. When faced with a client who desires rapid aerobic improvements, a CES should employ a problem-solving framework that integrates client-centered communication, physiological understanding, and ethical considerations. The process begins with active listening to understand the client's goals and motivations. Next, the CES must translate these goals into physiological terms, explaining the mechanisms of aerobic adaptation in an accessible manner. This involves educating the client about the time course of changes in VO2 max, mitochondrial function, and capillary density, emphasizing that these are gradual processes. The CES should then collaboratively design a progressive exercise program that aligns with these physiological realities and the client's current fitness level, clearly outlining the expected timeline for improvements and the rationale behind the program's structure. Regular reassessment and open communication are crucial to monitor progress, address any concerns, and make necessary adjustments while reinforcing the principles of safe and effective training. Question 12. System analysis indicates that a client undergoing a supervised exercise program for general fitness begins to report progressive weakness in their extremities, intermittent tingling sensations, and a noticeable decline in coordination during functional movements that were previously performed with ease. The CES observes these changes and notes that they are not typical of exercise-induced fatigue. What is the most appropriate course of action for the clinical exercise specialist in this situation? Option A. Educate the client on common causes of fatigue and reassure them that these symptoms will likely resolve with continued exercise and proper nutrition. Option B. Attempt to modify the exercise program to specifically target the reported weakness and tingling, hypothesizing that improved muscle strength will resolve the neurological symptoms. Option C. Immediately discontinue the current exercise session, document the client's reported symptoms and observations, and refer the client to their physician for a comprehensive medical evaluation. Option D. Advise the client to rest for a few days and then resume the exercise program at a reduced intensity, assuming the symptoms are due to overtraining. The correct answer is C. Immediately discontinue the current exercise session, document the client's reported symptoms and observations, and refer the client to their physician for a comprehensive medical evaluation. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent complexity of the nervous system and the potential for misinterpretation of subtle neurological signs. Clinical exercise specialist, CES, must navigate the balance between providing appropriate exercise interventions and recognizing the limits of their scope of practice, especially when symptoms suggest a potential underlying neurological pathology that requires medical evaluation. The challenge lies in accurately assessing the client's presentation, differentiating between exercise-induced fatigue and potential neurological dysfunction, and making a timely and appropriate referral. Correct approach analysis. The correct approach prioritizes client safety and adheres to the scope of practice for a CES. By recognizing that the client's symptoms, e.g., progressive weakness, altered sensation, coordination issues, extend beyond typical exercise fatigue and could indicate a neurological issue, the CES demonstrates sound professional judgment. This approach aligns with ethical guidelines that mandate practitioners to act in the best interest of the client and to refer to appropriate medical professionals when their expertise is insufficient or when a condition may be beyond their scope. Specifically, this aligns with the principle of do no harm and the requirement to practice within one's defined competencies. Prompt referral to a physician or neurologist ensures the client receives a proper diagnosis and management plan, which is crucial for conditions affecting the nervous system. Incorrect approaches analysis. One incorrect approach involves continuing with the prescribed exercise program despite the concerning neurological symptoms. This fails to acknowledge the potential severity of the client's presentation and could exacerbate an underlying neurological condition, leading to harm. Ethically, this violates the duty of care and the principle of non-maleficence. From a regulatory standpoint, it could be considered practicing outside the scope of a CES if the intervention is not appropriate for the suspected condition. Another incorrect approach is to dismiss the symptoms as normal exercise adaptation or deconditioning without further investigation. This demonstrates a lack of critical assessment and a failure to recognize potentially serious signs. It neglects the CES's responsibility to monitor client response to exercise and to identify deviations from expected outcomes. This can lead to delayed diagnosis and treatment for the client, which is a significant ethical lapse. A third incorrect approach is to attempt to diagnose the neurological condition or prescribe specific treatments for it. This directly exceeds the scope of practice for a CES. Diagnosing and treating medical conditions are the purview of licensed medical professionals. Attempting to do so constitutes practicing medicine without a license, which is a serious regulatory and ethical violation. Professional reasoning. When faced with a client exhibiting symptoms that deviate from expected exercise responses and suggest potential neurological involvement, a CES should follow a structured decision-making process. This involves 1. Thoroughly assessing the client's symptoms, noting their onset, progression, and specific characteristics. 2. Considering the client's medical history and any pre-existing conditions. 3. Evaluating whether the symptoms are consistent with exercise-induced fatigue or could indicate a more serious underlying issue. 4. Consulting relevant professional guidelines and scope of practice documents. 5. If there is any doubt or concern regarding neurological symptoms, prioritizing client safety by discontinuing the current exercise session and making an immediate referral to a qualified medical professional, e.g., physician, neurologist, for further evaluation and diagnosis. Documentation of the assessment. the client's reported symptoms, and the referral made is also a critical step. Question 13. The performance metrics show a client achieving a ventilatory threshold, VT, at a lower relative exercise intensity than anticipated based on their reported fitness level and previous training sessions, with a corresponding increase in the ratio of ventilation to oxygen uptake, V/VO2, without a significant rise in the ratio of ventilation to carbon dioxide production, V/VCO2. What is the most appropriate next step for the clinical exercise specialist? Option A. Adjust the exercise prescription to a lower intensity and monitor for improvements in gas exchange efficiency and subjective comfort during subsequent sessions, while considering potential factors influencing ventilatory control. Option B. Continue with the planned exercise intensity, as the client is not reporting significant dyspnea, and the observed metrics are within a range considered acceptable for some individuals. Option C. Immediately increase the exercise intensity to challenge the client's cardiovascular system further, assuming the observed metrics indicate a need for greater stimulus. Option D. Advise the client to cease exercise and refer them for immediate medical evaluation for a potential pulmonary disorder, based solely on the altered VE/VO2 ratio. The correct answer is A. Adjust the exercise prescription to a lower intensity and monitor for improvements in gas exchange efficiency and subjective comfort during subsequent sessions, while considering potential factors influencing ventilatory control. Explanation: this scenario is professionally challenging because it requires the clinical exercise specialist, CES, to interpret physiological data related to gas exchange and transport in the context of a client's exercise response, while adhering strictly to the regulatory framework governing their practice. The CES must balance the client's immediate performance with potential underlying physiological limitations or risks that might not be immediately apparent from subjective feedback alone. Careful judgment is required to ensure that interventions are safe, effective, and compliant with professional standards. The correct approach represents best professional practice because it prioritizes a comprehensive understanding of the client's physiological status by integrating objective data, gas exchange metrics, with subjective reporting and the client's overall health profile. This aligns with the ethical and regulatory imperative for CES professionals to practice within their scope, utilizing evidence-based methodologies and ensuring client safety. Specifically, by considering the ventilatory threshold, VT, and the relationship between oxygen uptake, VO2, and carbon dioxide production, VCO2, the CES can make informed decisions about exercise intensity and progression, thereby optimizing training benefits while minimizing risks, consistent with guidelines for exercise prescription and client monitoring. An incorrect approach that focuses solely on subjective client feedback without considering objective gas exchange data fails to uphold the professional standard of care. This could lead to overexertion or undertraining, potentially exacerbating underlying conditions, or failing to achieve therapeutic goals, which could be construed as negligence under professional practice guidelines. Another incorrect approach that involves making definitive diagnoses or prescribing medical interventions based on the gas exchange data would exceed the CES scope of practice. This would violate regulatory boundaries, as diagnosis and medical prescription are the purview of licensed physicians or other healthcare providers. Such an action could lead to inappropriate treatment and harm to the client, representing a significant ethical and regulatory breach. A third incorrect approach that involves ignoring the gas exchange data altogether and proceeding with a standard exercise protocol would also be professionally unsound. This disregards valuable objective information that could inform exercise prescription and risk stratification, potentially leading to suboptimal outcomes or overlooking critical physiological responses. It fails to leverage the full diagnostic and prescriptive capabilities available to a CES. The professional decision-making process for similar situations should involve a systematic evaluation of all available data, including subjective client reports, objective physiological measurements, and the client's medical history. The CES must then interpret this information within their defined scope of practice, consulting with other healthcare professionals when necessary. The primary focus should always be on client safety, adherence to regulatory requirements, and the application of evidence-based practices to achieve desired client outcomes. Question 14. The risk matrix shows a moderate likelihood of adverse events if a client with a history of ligamentous laxity and tendinopathy is subjected to high-impact plyometric exercises without adequate preparatory conditioning. The client, however, is eager to return to their previous sport and is requesting a program that mirrors their pre-injury training intensity. As a clinical exercise specialist, how should you proceed? Option A. Immediately implement a high-intensity plyometric program as requested by the client to facilitate a rapid return to sport, assuming their desire indicates readiness. Option B. Conduct a comprehensive functional assessment focusing on the stability and resilience of the client's connective tissues, and then design a progressive exercise program that gradually introduces plyometric elements, educating the client on the rationale and risks. Option C. Refuse to incorporate any plyometric exercises into the program, citing the client's history, and focus solely on low-impact cardiovascular training. Option D. Proceed with a high-intensity plyometric program, but advise the client to listen to their body, and stop if they experience pain, without further specific guidance on tissue limitations. The correct answer is B. Conduct a comprehensive functional assessment focusing on the stability and resilience of the client's connective tissues, and then design a progressive exercise program that gradually introduces plyometric elements, educating the client on the rationale and risks. Explanation. Scenario analysis. This scenario presents a professional challenge due to the conflict between a client's perceived immediate need and the clinical exercise specialist's CES professional responsibility to ensure safety and efficacy based on an understanding of connective tissue limitations. The CES must balance client autonomy with their duty of care, particularly when a client's desire for rapid progress might lead to injury due to compromised connective tissue integrity. The CES's knowledge of how different connective tissues, tendons, ligaments, cartilage, fascia, respond to stress, and their role in joint stability and movement is critical here. Overloading compromised tissues can lead to acute tears, chronic inflammation, or delayed healing, impacting long-term functional capacity. Correct approach analysis. The correct approach involves a thorough assessment of the client's current connective tissue status, considering their medical history, any reported symptoms, and objective findings. This assessment informs the development of a progressive exercise program that respects the healing and adaptive capacities of their connective tissues. The CES should educate the client about the specific roles of their connective tissues, the risks associated with overexertion, and the rationale behind a gradual approach. This aligns with the CES's ethical obligation to provide safe and effective exercise programming, adhering to professional standards of practice that prioritize client well-being and evidence-based interventions. This approach respects the client's goals while ensuring their physical integrity is not jeopardized, fostering trust and long-term adherence. Incorrect approaches analysis. One incorrect approach involves immediately accommodating the client's request for an intense program without a comprehensive assessment. This disregards the CES's responsibility to understand the physiological limitations imposed by the client's connective tissue health. It risks exacerbating existing conditions or causing new injuries, violating the principle of do no harm, and potentially leading to professional negligence. Another incorrect approach is to dismiss the client's request outright and refuse to modify the program without adequate explanation or exploration of alternatives. This can damage the therapeutic relationship, undermine client motivation, and fail to address the client's underlying desire for progress. It demonstrates a lack of client-centered care and an unwillingness to collaborate on a safe and effective plan. A third incorrect approach is to proceed with the intense program while downplaying the potential risks associated with compromised connective tissues. This is ethically unsound, as it involves a failure to adequately inform the client of potential dangers and obtain informed consent regarding the risks. It also demonstrates a lack of professional diligence in applying knowledge of biomechanics and tissue healing. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough client assessment, integrating information about their medical history, current physical status, and functional goals. This assessment should specifically consider the integrity and function of connective tissues. Following the assessment, the CES should engage in open communication with the client, explaining the findings and the rationale for the proposed exercise plan. This includes educating the client about the physiological principles guiding the program, particularly concerning connective tissue response to exercise. When conflicts arise between client desires and professional recommendations, the CES must prioritize safety and evidence-based practice, seeking collaborative solutions that respect the client's autonomy within safe parameters. If a client's request poses a significant risk, the CES must clearly articulate these risks and propose alternative, safer strategies to achieve their goals. Question 15. The efficiency study reveals that a client's exercise program is not yielding optimal improvements in oxygen saturation. Considering the anatomy of the respiratory tract, which region is primarily responsible for the diffusion of oxygen into the bloodstream and carbon dioxide out of the bloodstream, and therefore the most critical area to consider for optimizing gas exchange during exercise. Option A, trachea. Option B, pharynx. Option C, alveoli. Option D, bronchioles. The correct answer is C, alveoli. Explanation: scenario analysis. This scenario is professionally challenging because it requires a clinical exercise specialist, CES, to interpret physiological data related to respiratory function in the context of an exercise intervention. Misinterpreting the anatomy and physiology of the respiratory tract can lead to inappropriate exercise prescription, potentially exacerbating a client's condition or failing to achieve therapeutic goals. The CES must integrate knowledge of airway structure, gas exchange mechanisms, and the impact of exercise on these systems to make sound clinical decisions. Correct approach analysis. The correct approach involves recognizing that the primary site of gas exchange, where oxygen enters the bloodstream and carbon dioxide is removed, is the alveoli. This understanding is crucial for designing exercise programs that optimize oxygen uptake and utilization, particularly for individuals with respiratory impairments. Adhering to the anatomical and physiological principles of the respiratory tract ensures that exercise interventions are evidence-based and tailored to the client's specific needs and limitations, aligning with the CES's professional responsibility to provide safe and effective care. Incorrect approaches analysis. Focusing solely on the trachea as the primary site of gas exchange is incorrect because the trachea is part of the conducting zone, responsible for air passage, not diffusion. This misunderstanding would lead to an incomplete appreciation of how exercise impacts oxygenation. Identifying the bronchioles as the main area for gas exchange is also incorrect. While terminal and respiratory bronchioles are involved in some gas exchange, their capacity is significantly less than that of the alveoli, which constitute the vast majority of the gas exchange surface area. Attributing the primary role of gas exchange to the pharynx is fundamentally flawed. The pharynx is part of the upper respiratory tract, involved in air and food passage, and plays no direct role in the diffusion of gases between the lungs and the blood. Professional reasoning. Professionals should approach such scenarios by first recalling the detailed anatomy and physiology of the respiratory tract, specifically identifying the functional units responsible for gas exchange. They should then consider how exercise impacts these structures and processes. When presented with data or a clinical situation, the CES must critically evaluate the information against their foundational knowledge. If there is any uncertainty, consulting authoritative texts, peer-reviewed literature, or seeking guidance from a qualified supervisor or colleague is essential. The decision-making process should prioritize client safety and the efficacy of the prescribed intervention, grounded in scientific principles. Question 16. Cost-benefit analysis shows that implementing a more rigorous anaerobic exercise protocol for a client experiencing premature fatigue and shortness of breath during high-intensity intervals could yield faster improvements in anaerobic capacity. However, these symptoms might also indicate an underlying physiological issue affecting the efficiency of anaerobic glycolysis. Given the clinical exercise specialist (CES) scope of practice and regulatory guidelines, what is the most appropriate course of action? Option A. Immediately reduce the intensity and duration of all high-intensity intervals to prevent further symptoms without consulting a physician. Option B. Advise the client to rest for a week and then resume the current high-intensity interval training program. Option C. Refer the client to their physician for medical evaluation and clearance before proceeding with any modifications to the current exercise program. Option D. Continue with the current high-intensity interval training program, assuming the client will adapt over time. Correct answer is C. Refer the client to their physician for medical evaluation and clearance before proceeding with any modifications to the current exercise program. Explanation. Scenario analysis. This scenario presents a common challenge for clinical exercise specialists, CES, where a client's physiological response to exercise, specifically related to anaerobic glycolysis, may be influenced by an undiagnosed or poorly managed underlying condition. The CES must balance the immediate need to provide effective exercise programming with the paramount responsibility of client safety and adherence to professional scope of practice. The challenge lies in interpreting subtle physiological cues and knowing when to escalate care beyond the CES's direct expertise without causing undue alarm or disrupting the client's progress unnecessarily. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing client safety and adhering to the scope of practice for a CES. Recognizing that symptoms like premature fatigue and shortness of breath during high-intensity intervals, which are indicative of a potential disruption in anaerobic glycolysis efficiency, could stem from a medical condition, the CES correctly identifies the need for medical clearance. This aligns with regulatory frameworks that mandate CES to operate within their competency and refer clients to appropriate healthcare professionals when their condition warrants it. Specifically, this approach upholds the ethical principle of non-maleficence, do no harm, by preventing potential exacerbation of an underlying issue. It also respects the collaborative nature of healthcare, ensuring the client receives comprehensive care. Incorrect approaches analysis. One incorrect approach involves continuing with the current high-intensity interval training, HIIT, program without further investigation. This is a regulatory and ethical failure because it disregards the potential for an underlying medical condition to be the cause of the client's symptoms. It violates the principle of beneficence, acting in the client's best interest, by potentially pushing the client beyond their safe physiological limits and could lead to adverse events, a direct contravention of safe practice guidelines. Another incorrect approach is to immediately discontinue all exercise without a proper referral. While cautious, this is not the best professional practice as it may unnecessarily alarm the client and could lead to deconditioning. It fails to acknowledge that the client's symptoms might be manageable with appropriate medical intervention and a modified exercise plan, thus not fully exploring all avenues for the client's well-being. It also bypasses the opportunity for a collaborative approach with a physician. A third incorrect approach is to simply reduce the intensity of the HIIT program without seeking medical input. While this might temporarily alleviate symptoms, it fails to address the root cause. This approach is a failure because it does not investigate the underlying physiological mechanism contributing to the premature fatigue and shortness of breath, which could be indicative of a more serious issue. It also risks masking symptoms, potentially delaying diagnosis and appropriate treatment, thereby compromising client safety and the CES's professional responsibility to ensure the client's health is not jeopardized. Professional reasoning. When faced with a client exhibiting symptoms that suggest a potential physiological limitation impacting anaerobic glycolysis, a CES should employ a systematic decision-making process. This involves 1. Observation and assessment, carefully noting the client's subjective and objective responses to exercise. 2. Hypothesis generation, considering potential causes for the observed responses, including physiological limitations related to energy systems and potential underlying medical conditions. 3. Scope of practice evaluation, determining if the observed symptoms fall within the CES's expertise or require referral. 4. Consultation and referral. If a medical condition is suspected, initiating a referral to a physician for diagnosis and clearance. 5. Collaborative planning, working with the client and their healthcare provider to develop a safe and effective exercise program. This framework ensures that client safety is paramount while still facilitating progress towards their fitness goals. Question 17. Compliance review shows a clinical exercise specialist, CES, is developing an exercise program for a client with a history of insulin resistance and elevated cortisol levels. The client reports feeling fatigued and experiencing fluctuations in energy throughout the day. Which of the following approaches best addresses the hormonal regulation of metabolism in this client's exercise prescription? Option A. Focus solely on dietary recommendations to manage insulin resistance and cortisol levels, deferring all exercise prescription to the client's physician without any direct CES involvement. Option B. Recommend a low-intensity, low-duration exercise program with minimal stress, as any form of exercise might exacerbate the client's hormonal imbalances and fatigue. Option C. Design an exercise program that incorporates moderate-intensity aerobic exercise and resistance training, focusing on consistency and gradual progression, while monitoring the client's subjective energy levels and seeking physician input regarding any specific hormonal management strategies. Option D. Implement a high-intensity interval training (HIIT) program to maximize calorie expenditure and rapidly improve insulin sensitivity, assuming that intense exercise will override any negative hormonal influences. Correct answer is C. Design an exercise program that incorporates moderate-intensity aerobic exercise and resistance training, focusing on consistency and gradual progression, while monitoring the client's subjective energy levels and seeking physician input regarding any specific hormonal management strategies. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires a clinical exercise specialist, CES, to interpret and apply complex physiological information regarding hormonal regulation of metabolism in the context of a client's specific health status and exercise program. The challenge lies in ensuring that the exercise prescription is not only safe and effective, but also considers the potential impact of exercise on hormonal balance, which can influence metabolic outcomes. Misinterpreting these interactions could lead to suboptimal results or adverse effects for the client. Correct approach analysis. The correct approach involves a thorough assessment of the client's current hormonal status, if available and relevant, and understanding how different exercise modalities and intensities might influence key metabolic hormones like insulin, glucagon, cortisol, and thyroid hormones. This approach prioritizes evidence-based practice and a personalized, holistic view of the client's health. It aligns with the CES's responsibility to design exercise programs that are physiologically sound and tailored to individual needs, thereby maximizing benefits and minimizing risks. This is ethically mandated by the CES's Professional Code of Conduct, which emphasizes client well-being and competent practice. Incorrect approaches analysis. One incorrect approach would be to ignore the client's reported hormonal imbalances and proceed with a generic exercise program. This fails to acknowledge the significant impact hormones have on metabolism and exercise response, potentially leading to an ineffective or even detrimental program. This constitutes a failure in professional competence and a breach of the ethical duty to provide individualized care. Another incorrect approach would be to make assumptions about hormonal regulation without consulting relevant medical information or seeking clarification from the client's physician. This oversteps the CES's scope of practice and could lead to inappropriate exercise recommendations based on incomplete or inaccurate information. This is a regulatory failure as it bypasses established protocols for client care and a potential ethical failure due to practicing outside one's expertise. A further incorrect approach would be to solely focus on exercise intensity without considering the potential for exercise-induced stress to exacerbate existing hormonal dysregulation, particularly in conditions like adrenal insufficiency or thyroid disorders. This demonstrates a lack of understanding of the nuanced interplay between exercise and the endocrine system, leading to a potentially harmful prescription. This is a failure in applying scientific knowledge to practice and a breach of the duty of care. Professional reasoning. When faced with a client presenting with or reporting hormonal imbalances that affect metabolism, a CES should adopt a systematic decision-making process. This begins with gathering comprehensive information, including any relevant medical diagnoses, physician recommendations, and current medications. The CES should then critically evaluate how these factors might influence exercise tolerance and metabolic response. Collaboration with the client's healthcare team is paramount to ensure the exercise program is integrated with their overall medical management. The CES must then design an exercise program that is individualized, considering exercise type, intensity, duration, and frequency, with a focus on promoting metabolic health while respecting the client's hormonal status. Regular monitoring and reassessment are crucial to adjust the program as needed based on the client's response and any changes in their hormonal profile or medical condition. Question 18. The audit findings indicate a need to review the process by which resistance training programs are adapted for clients exhibiting signs of training plateau or increased subjective fatigue. Which of the following represents the most appropriate approach for a clinical exercise specialist to take in response to these findings? Option A. Systematically analyze the client's resistance training log for objective performance metrics and subjective feedback. Compare this data against principles of exercise adaptation and make evidence-based adjustments to training variables, e.g., volume, intensity, frequency, exercise selection, to optimize progress and minimize risk. Option B. Continue the current resistance training program without modification, even if objective performance data shows a plateau and the client reports increased fatigue and muscle soreness. Option C. Arbitrarily increase the training intensity or volume of the resistance training program to challenge the client, without a thorough assessment of their recovery status or performance data. Option D. Implement significant changes to the resistance training program based solely on the client's verbal report of feeling tired or bored, without consulting objective performance data or assessing their overall training load. The correct answer is A. Systematically analyze the client's resistance training log for objective performance metrics and subjective feedback. Compare this data against principles of exercise adaptation and make evidence-based adjustments to training variables, e.g., volume, intensity, frequency, exercise selection, to optimize progress and minimize risk. Explanation. Scenario analysis. This scenario presents a common challenge in clinical exercise physiology, ensuring client safety and efficacy when adapting resistance training programs based on individual responses. The audit findings highlight a potential gap in the systematic evaluation of client progress and the justification for program modifications. A CES must balance the need for progressive overload to achieve training goals with the imperative to avoid overtraining, injury, or adverse health events, especially in individuals with specific health conditions. The challenge lies in moving beyond subjective observation to a data-driven, evidence-based approach that is both clinically sound and compliant with professional standards. Correct approach analysis. The correct approach involves a systematic review of the client's resistance training log, including objective measures of performance, e.g., weight lifted, repetitions, sets, rest periods, and subjective feedback, e.g., perceived exertion, pain levels, fatigue. This data is then compared against established physiological principles of adaptation to resistance training, such as the principle of progressive overload, specificity, and recovery. The CES must analyze this information to determine if the current training stimulus is appropriate, if the client is demonstrating signs of adaptation, or if there are indicators of overreaching or overtraining. Based on this comprehensive analysis, the CES can then make informed, evidence-based decisions about appropriate modifications, such as adjusting training volume, intensity, frequency, or exercise selection, to optimize adaptation and minimize risk. This aligns with the ethical obligation to provide competent and safe care, adhering to the scope of practice for a clinical exercise specialist. Incorrect approaches analysis. One incorrect approach involves making significant changes to the resistance training program solely based on the client's verbal report of feeling tired or bored, without objective performance data or a thorough assessment of their training load. This approach lacks the rigor required for clinical decision-making. It fails to differentiate between normal training fatigue and potential overtraining, and it bypasses the systematic evaluation of training adaptations. Ethically, this could lead to undertraining if the client is capable of more, or overtraining if the fatigue is a symptom of excessive load, both of which compromise client well-being and the effectiveness of the intervention. It also fails to meet the standard of care expected of a CES who should be utilizing objective data to guide programming. Another incorrect approach is to continue the current resistance training program without any modifications, despite objective evidence of plateaued performance or increased subjective complaints of fatigue and muscle soreness. This demonstrates a failure to apply the principle of progressive overload and to respond to the client's physiological and psychological responses to training. It can lead to detraining, demotivation, and an increased risk of injury due to accumulated fatigue. From a regulatory and ethical standpoint, this represents a failure to provide appropriate and individualized care, potentially violating standards of practice that mandate program adjustments based on client response and progress. A third incorrect approach is to arbitrarily increase the training intensity or volume without a clear rationale derived from the client's performance data or a reassessment of their recovery status. This can be driven by a misunderstanding of progressive overload or a desire to push the client without adequate consideration for their current capacity. This approach significantly increases the risk of overtraining, injury, and adverse events, particularly for clients with underlying health conditions. It is a direct contravention of the CES's duty to prioritize client safety and to implement evidence-based practices. Professional reasoning. When faced with audit findings related to resistance training adaptations, a CES should first acknowledge the importance of a systematic and data-driven approach. The professional decision-making process should involve 1. Reviewing all available client data, including training logs, subjective feedback, and any relevant physiological assessments. 2. Comparing this data against established principles of exercise physiology and the client's individual goals and health status. 3. Identifying any discrepancies between expected adaptations and actual client responses. 4. Formulating a rationale for any proposed program modifications based on this analysis. 5. Clearly documenting the rationale for all program changes and communicating them to the client. This process ensures that decisions are evidence-based, client-centered, and aligned with professional standards and ethical obligations. Question 19. Market research demonstrates that individuals with chronic respiratory conditions often seek to improve their functional capacity through supervised exercise programs. A clinical exercise specialist, CES, is working with a client diagnosed with moderate COPD. During a graded exercise test, the client reports a significant increase in shortness of breath dyspnea and a decrease in SpO2 from 94% to 90% at an intensity of 60% of their predicted maximum heart rate. The client's perceived exertion, RPE, on the Borg scale is 7 out of 10. What is the most appropriate immediate course of action for the CES? Option A. Advise the client to increase their breathing rate to compensate for the perceived shortness of breath and continue the exercise test to assess their tolerance to higher intensities. Option B. Immediately stop the exercise test, have the client rest, and document the findings. Advise the client to consult their physician for further evaluation of their respiratory status before continuing exercise. Option C. Continue the exercise test at the current intensity, as the SpO2 is still within a generally acceptable range for individuals with COPD, and the client's RPE is not yet at maximal effort. Option D. Immediately terminate the exercise test and instruct the client to seek emergency medical attention due to the drop in SpO2. The correct answer is B. Immediately stop the exercise test, have the client rest, and document the findings. Advise the client to consult their physician for further evaluation of their respiratory status before continuing exercise. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires a clinical exercise specialist, CES, to interpret and apply complex respiratory assessment data within the context of a client's specific medical history and current functional limitations. The challenge lies in distinguishing between normal physiological responses to exercise and potential indicators of underlying respiratory compromise that might necessitate referral or modification of the exercise program. This requires a nuanced understanding of respiratory physiology, exercise science, and the scope of practice for a CES, ensuring client safety and adherence to professional standards. Correct approach analysis. The correct approach involves a systematic evaluation of the client's subjective symptoms, e.g., dyspnea, chest tightness, in conjunction with objective physiological measures, e.g., SpO2, RPE. This integrated assessment allows the CES to determine if the observed respiratory responses are within expected parameters for the given exercise intensity and the client's known condition. If the data suggests a potential issue, the CES must then consult the client's physician or a qualified respiratory therapist for further evaluation and guidance. This aligns with the CES scope of practice, emphasizing client safety, evidence-based practice, and appropriate referral pathways as mandated by professional guidelines and ethical considerations for healthcare professionals. The CES's role is to facilitate safe and effective exercise, not to diagnose or manage respiratory disease independently. Incorrect approach is analysis. One incorrect approach would be to solely rely on objective SpO2 readings without considering the client's subjective experience. A SpO2 reading might remain within acceptable limits, but a client experiencing significant dyspnea could indicate a problem that the SpO2 alone does not capture. This neglects the holistic assessment of the client and could lead to overlooking critical signs of respiratory distress, violating the principle of client-centered care and potentially leading to adverse events. Another incorrect approach would be to immediately terminate the exercise session and advise the client to seek immediate medical attention based solely on a minor, transient drop in SpO2 that resolves quickly with rest and is not accompanied by significant dyspnea. While caution is paramount, an overly aggressive response without considering the context and the client's overall presentation can be unnecessary and may undermine the client's confidence in exercise. This fails to apply clinical judgment and could be seen as exceeding the CES's scope of practice by making an unsubstantiated urgent referral. A third incorrect approach would be to ignore the client's reported increase in dyspnea, attributing it solely to deconditioning, and continuing with the prescribed exercise intensity. This disregards subjective client feedback, which is a crucial component of exercise assessment. It also fails to acknowledge that increased dyspnea can be a sign of worsening respiratory function, potentially leading to overexertion and exacerbation of the underlying condition, thereby compromising client safety and violating ethical obligations to provide appropriate care. Professional reasoning. Professionals should employ a decision-making framework that prioritizes client safety through a comprehensive, multifaceted assessment. This involves 1. Gathering subjective and objective data. 2. Comparing this data against established norms and the client's baseline. 3. Identifying any deviations that warrant further investigation. 4. Consulting with other healthcare professionals when the CES's scope of practice is approached or exceeded. 5. Documenting all assessments and interventions thoroughly. This systematic approach ensures that decisions are informed, evidence-based, and ethically sound, safeguarding the client's well-being. Question 20. The control framework reveals that when designing an exercise program for a client aiming to improve explosive power in activities lasting less than 10 seconds, a clinical exercise specialist must accurately assess the primary energy system utilized. Which of the following best describes the predominant energy system responsible for providing immediate ATP during such high-intensity, short-duration efforts? Option A. The anaerobic glycolysis system is the primary source of ATP for the initial 6-10 seconds of maximal effort. Option B. The lactic acid system is the primary source of ATP for the initial 6-10 seconds of maximal effort. Option C. The aerobic oxidative system is the primary source of ATP for the initial 6-10 seconds of maximal effort. Option D. The phosphagon system, ATP-CP, is the primary source of ATP for the initial 6-10 seconds of maximal effort. The correct answer is D. The phosphagon system, ATP-CP, is the primary source of ATP for the initial 6-10 seconds of maximal effort. Explanation. The control framework reveals that a clinical exercise specialist, CES, must understand the physiological underpinnings of exercise to effectively design and implement programs. When considering the ATP-CP system, a CES faces the challenge of differentiating its role from other energy systems in various exercise contexts. This requires a nuanced understanding of exercise intensity, duration, and the specific demands placed on the body. The CES must also consider how individual client factors, such as training status and age, might influence the reliance on and capacity of this system. The correct approach represents best professional practice because it accurately identifies the primary role of the ATP-CP system in high-intensity, short-duration activities. This aligns with the physiological principles that guide exercise prescription. By recognizing that the ATP-CP system is the immediate energy source for explosive movements, a CES can appropriately select exercises and prescribe intensities that target this system for clients aiming to improve power, speed, or strength. This is ethically sound as it ensures the program is physiologically appropriate and safe, maximizing potential benefits while minimizing risks. An incorrect approach that overemphasizes the ATP-CP system's contribution to prolonged endurance activities is professionally challenging and ethically problematic. This would lead to a misapplication of training principles, potentially resulting in ineffective programming and client dissatisfaction. It fails to adhere to the scientific understanding of energy system contribution, which is a core competency for a CES. Furthermore, it could lead to premature fatigue and an increased risk of injury if clients are pushed beyond their capacity without appropriate energy system support. Another incorrect approach that dismisses the ATPCP system's relevance entirely for any client is also professionally unsound. While its contribution diminishes with longer durations, it is still a critical component of the initial seconds of all-out effort, even in longer events. Ignoring it would mean missing opportunities to enhance performance in specific phases of activity or for clients with certain goals. This demonstrates a lack of comprehensive physiological knowledge, which is a breach of professional responsibility. The professional reasoning process for a CES in such a scenario involves a systematic evaluation of the client's goals, the physiological demands of the proposed activities, and the known contributions of different energy systems. The CES should consult current evidence-based guidelines and their scope of practice. When in doubt, seeking consultation with more experienced professionals or relevant literature is paramount. This iterative process of assessment, planning, implementation, and evaluation, grounded in scientific principles and ethical considerations, ensures that exercise interventions are safe, effective, and tailored to individual needs.